Okay, doing a quick audio check. Are you able to hear me online?
Yes,
Yes,
we
we
hear you.
can.
Yes. Yes, can hear you.
All right, thank you for that. Good morning. This is Paul Troxel, the 988 Systems Director. It is 10:01. We do have one board member who is stuck in traffic. She'll be arriving soon. So we're going to give her a few minutes to get settled in here, and then we'll begin the meeting. All right. Good morning, everybody. Again, doing a sound check for those folks online. Are you able to hear me?
Yes.
Perfect. Thank you for that. Good morning. My name is Paul Troxel. I'm the 988 Systems Director, 911 Branch Manager. It is 10:06 on February 20th, and we're going to start our 988 Technical Advisory Board. We'll start with our welcome and call to order, roll call of all of our members. Dr. Raflayan.
I'm here.
Thank you. Joe Sullivan. Terry Galvan.
Here.
Julian Aragon.
Here.
Lon Nguyen.
Here, remotely.
Thank you, sir. Kristen Miller. Ametria Sidney.
Here.
Jeff Hebert.
Here.
Tracy Gonzalez. Jennifer Kenton. Aaron Riley. Jamila Fields.
Here.
Serena Lewis.
Here.
Thank you very much. We do have quorum. We have 8 in the room with 1 board member online. Thank you for joining us this morning. Our first
May
order.
I say that I'm present too?
I'm sorry. Did I miss you? Oh my. Dr. Bowie, I formally apologize. I skipped right over your name. I'm sorry. All right. With the establishment of quorum, our first item on the agenda is the approval of our previous minutes. The November 2024 meeting, we did not achieve quorum. So we've got to go back to the August 2024 meeting minutes for review and approval. So for the board members, do we have a motion to approve the minutes?
Approved.
Thank you. We have a motion. Do we have a second?
Second,
Okay, thank you. All right, thank you. Okay, we'll do a roll call vote for those members in attendance. Dr. Bowie, motion to approve the meeting minutes. Thank you. Dr. Raffayan,
Vote to approve.
thank you. Terry Galvan,
Approved.
Julian Aragon,
Yes.
Lon Nguyen,
aye.
Ametria Sidney,
Approved.
Jeff Hebert,
Yes.
Jamila Fields.
Was not a member of the board at the time.
Okay, so an abstain from vote. And Serena Lewis,
Approved.
motion with 8 votes, the meeting minutes are approved. Uh-oh. There we go. Sorry, I was having technical difficulties with the clicker to advance our slides. The next item, we have a legislative update, and I believe Paul McGinnis from the Cal OES Legislative Affairs team is online to brief us on legislative initiatives.
Yes, good morning. Thank you, Paul. Can you hear me in the room?
Yes, sir.
Great. My name's Paul McGinnis. I'm the legislative coordinator here at Cal OES. I'm going to briefly go over a couple key legislative dates that are upcoming, as well as about 6 state bills and 1 federal bill that may be of interest to the advisory board at this time. So just a couple key dates here. The deadline for the legislature to introduce all bills is actually tomorrow, February 21st. After that, the next key deadline is May 2nd, which is the last day for policy committees to meet and report fiscal bills in the first house. After that, May 23rd is the last day for fiscal committees to meet in the first house. And then June 6th is the last day for the first house to pass bills to the opposite house. I'm going to now run through just a few bills. One disclaimer is that some of these are spot bills. A spot bill is a non-substantive bill at this time, but we anticipate that more details and language will be added in the future. And then also just letting folks know, I'll make the list I have here available to the board through Dylan, I believe, after the meeting. So the first bill here is AB 330 by Assemblymember Rogers. This bill's an amendment to the local prepaid mobile telephony act, and it would extend the sunset for the surcharge on prepaid cell phone services from 2026 to 2031. The bill is currently in the Assembly Revenue and Tax Committee. Next bill is AB 470. This is a spot bill. It states the intent of the legislature to enact legislation relating to telecommunications by Assemblymember McKinner, and this one's eligible to be heard in committee on March 9th. The next bill I'd like to share is AB 645. This one would state the intent of the legislature to enact a bill to require emergency dispatchers to be trained as emergency medical dispatchers. This one is Assemblymember Carrillo and is eligible to be heard in committee on March 16th. The next bill is AB 654, Assemblymember Caloza. This one would authorize a local agency to establish a homelessness resource telephone system to receive telephone calls regarding individuals who are experiencing or at the risk of experiencing homelessness in order to provide resources to those individuals. This bill is also eligible to be heard in committee on March 16th. Just a couple more bills that I'd like to share. AB 693, Assemblymember Borner. This bill, among other things, would establish the Department of Broadband and Digital Equity within the Government Operations Agency for the purpose of promoting a universal broadband deployment in unserved and underserved areas of the state and to increase broadband adoption throughout the state. This one's eligible to be heard in committee on March 17th. And then the last state bill I'd like to share is AB 727. This bill is titled Pupil and Student Safety for statewide resources for identification cards. So current law commencing on July 1st requires public or private schools that serve grades 7 through 10 to include the 988 suicide and crisis lifeline on students' identification cards. This bill commencing a year after that date, so July 1st, 26, would also require the Trevor Project hotline to be printed on those identification cards as well. There's also, so that completes the state bills. There's also one federal bill, S290 from Senator Barrazo, and this would direct the Secretary of the Interior to upgrade existing emergency communication centers and units of national park systems to the next gen 911 system and for other purposes. That one's in the Committee on Energy and Natural Resources as of January 29th. So as I stated, I'll share the list of the bills I have here with the group following the meeting, and pending any questions, that is the update for this morning.
Thank you, Mr. McGinnis. Appreciate the update. At this time, are there any questions from the board related to the legislative update? Do Do we have any public comments related to the legislative update?
Just a quick question. This is Lan Nguyen from online. Just a quick question. So I thought that I've learned that on the student ID, in the back of their ID already listed the 988 phone number, but it seems like that hasn't happened yet, not until now with this new bill. Is that correct, or is there something else to add to this bill?
So I believe the current law that's in statute makes that requirement by July 1st of this year. So it would actually be enforceable after July 1st of this year for the 988. And then this bill is looking to also add the Trevor Project hotline, which would, when that statute would be enforceable starting July 1st, 26. So approximately a year and a half from now.
Okay, thank you for that clarification.
Yep.
All right, thank you. Mr. McGinnis, thank you. We appreciate the update.
Yeah, thank you.
Our next item is working group reports. The 988 911 interface working group. Jeff, do you have any update from our last meeting on your working group?
No, we do not. We, from the last meeting where we talked about the feedback from various parties, some board members, and as well as some input that was provided from mental health community, the PSAPs, et cetera. We were looking at incorporating those changes into the document that was provided to the board for review. I haven't had a chance to do that. However, I would like to seek some sort of guidance from the board or what we want to do with the recently released NINA standards for 988 911 interface. For those who haven't seen it, the National Emergency Number Association put out a guidance document. I think they published it, or it was ANSI approved in January, late January, if I recall. Actually covers almost everything that we've been talking about, and very succinctly. I wouldn't say that guidance document addresses everything. However, I think that we should give it due consideration, especially since NINA does carry a lot of weight in the standards that are set forth for 911 and PSAPs throughout the nation.
Thank you. We do have an agenda topic, number 8 for today is the review of the transfer guidance document. Would you be prepared to further discuss the NINA document at that time, or should we hold that agenda topic for the May and then seek some more guidance from the board on your document and incorporation of the NINA standards?
When we get to that agenda item, I'd be happy to at least give the highlights that I've been able to review for the NINA document. I wouldn't say I'm an expert in it yet. It's very detailed. But I think I could probably touch on some highlights on what it does cover, and then that will relate to the document that my working group had put together and put forth. But I still think that it will be necessary for us to at least set a direction, make a decision, and then we can I can convene my working group with whatever the direction of the board is and the desire, and then we can talk about it at the May meeting.
Perfect. Thank you.
Mhm.
And then the next working group is the Accessibility and Equal Access Working Group. Dr. Bowie and Dr. Rafalayan, do you have an update from our last meeting on your working group efforts?
I do not have an update. I do believe we are seeking direction as well from the board in terms of what you would like the working group to do next.
Yeah, I would concur with that. Since we did not have a meeting, or the last board meeting, we did not have quorum and we didn't have any deliverables. Though one other thing that I would say as well is at the last board meeting in August, we had talked about the possibility of continuing some of the work that might be sunsetting at Cal HHS in terms of having a way to organize some of the folks that have already been providing input and guidance and advice. And there is already some overlap in the advisory group members.
So can we just remind the board members of some of the guidance or clarification you're seeking for the Accessibility and Equal Access Working Group? And then we could take that down. If we get that guidance today from the board, we could take that down as an action item for your working group.
I'll be talking about the Cal HHS AB 98 5-year implementation plan. Within that plan, there are a number of equity-focused implementation activities. I think that might be a good place for the Accessibility and Equitable Access Working Group to take a look at. And also then look at how it interfaces with the work of the Cal OES Technical Advisory Board. And I think come up with some proposals. We can certainly do that.
Perfect. When we get to that part of the agenda, as you work through that briefing, we can incorporate those questions for clarification. All right. Thank you. Are there any questions or discussion from the board on the working group reports at this time, pending further discussion on these other future agenda topics? All right. How about any public comments on this agenda topic? Right. Thank you. And with that, our next agenda topic is the Cal OES 988 report. As I had said, I'm Paul Truxell. I'm the 988 Systems Director, 911 Branch Manager. And when we started our meeting, I failed to introduce, to my right here, we have Lisa Mangat, who is our Acting Deputy Director of Public Safety Communications and Chief Deputy Director of Cal OES. She is filling the leadership role for our public safety communications team here, which includes 911 988. She has been assigned the chair for this meeting, and I'll be facilitating our meeting. Lisa, do you have anything you would like to say?
Yes, just I'm happy to be here. Just very quickly, one of the things that happened recently is we established a governor appointed position. Historically, public safety communication was nested within the logistics division. We've now broken them into two because we really wanted to elevate the executive sponsorship for the PSC division, and 988 is one of those critical programs nested under that. So I'm the first acting deputy director in that role, and we'll be doing a robust recruitment going forward. So thanks. Nice to work with all of you.
Thank you, ma'am. Appreciate that. For the Cal OES report, I'm very excited to share some of our activities, especially we did not achieve quorum in November, and we have Kurt Galat, who's our 988 project manager from the OES team here in the audience. And some of the recent activities that him and I have been working together on are certainly exciting. First is the MOU that Cal OES has been working with SAMHSA and Vibrant. I'm very happy to report that MOU has been finalized and signed. It is on its way to Washington. SAMHSA has been updated. I talked with them that MOU was signed a week ago. We met with the SAMHSA team. They're very excited and ready to work with us. And just to refresh everybody's memory, this MOU will allow California state platform to have 988 calls delivered into that platform. And this opens the door for continued collaboration with SAMHSA and then Vibrant as the national provider. I will be in Washington next week for an event, and I'm working with John Palmieri, and we'll be meeting with him. He's a representative from SAMHSA. He's very excited about our recent activities here in the state. We're going to sit down and really talk through where we are as a state, what our plan is, and how we're supporting our 12 Lifeline Crisis Centers. So that's our first order of exciting news. The second is a recent transition of our 988 system director role. I felt it was very important that I get out and meet the folks that are in these centers. And with the assistance of Kurt, we started in the Bay Area. We met with the 7 centers in the Bay Area and then met with Dee Hirsch about a week and a half ago. And that's 8 of the 12, and we are scheduling the remaining 4 to likely be by mid-March. We get the remaining 4. Very important for me is I want to understand what the needs of the center are. I think when we develop the state's platform, we develop thinking like a 911 center. You have a person answering a telephone call at a position in a room in a facility managed by the 988 center. And so when we developed, we were thinking, well, it's going to be just like that. We're going to order technology. We're going to install it at a desk. You're going to have somebody come in, they'll answer, somebody replaces them, somebody else sits down. And that's not necessarily the case. So we are taking a deeper dive into the needs assessment. And what we're looking to do is advance everything that we're doing today, looking at the future deployment and making sure that we're able to meet those needs. So later today, we're meeting with NGA, who's the vendor who provides the state's platform. And we're going to be talking through the initial set of data that we received from our first 8 visits, make sure that they're able to support the technology deployment, whether it's a physical position at a physical location where folks are going to come into work, or the ability to work remote. So if that's a laptop or some other type of technology, we want to make sure that that's being met. And then we've been able to validate that the state's technology has been installed in every back room of the 12 centers. And we have at least one position that's installed and ready to go in every one of the centers. So in our conversations, we're talking with the 988 centers on how they can start to bring in their local lines and start to train and use the system to make sure it's meeting their needs. And then if there's any development, we can collect that data and work with NGA to continue to evolve that platform to meet their needs. And then as we work with Vibrant to get that timeline on bringing in 988 calls to the state's platform, people will have gone through the training, they'll be familiar with the system, and they're going to be ready to log in and take those 988 calls when those start to be delivered to the state. So again, some very exciting news. And I do really want to thank the 988 centers. Everyone that we visited was very gracious with their time. And they were, they gave us their specific needs. And what I found is every center is a little different. Again, in 911, every center in 911, the operations may be different, but the room is the same. You have a bank of positions where 911 calls get answered. Somebody comes in, they sit down, they answer the call, they get up and they leave. There's not a lot of flexibility with that, where 988 there is. So as we look forward, we want to be able to support that need, and we need the feedback of the centers. We need the centers to be able to interact with you as board members, and then we need the feedback ultimately from you to make sure that we're meeting the needs. And then I'd like to especially call out DHHS and DHCS. We've met not as many times as we've wanted because things have been very busy, but we've been able to meet and I think get some really good traction on our relationship. And again, I think we're going in the right direction, and I'm excited about what we're doing in 988. And I believe with our project team and our current vendor being here to support us, we do have Chris Delano, who's the 988 project manager from NGA. He flew in for this afternoon's meeting. So we're prepared to support the 988 call delivery, and then the ability to answer those local lines, and then ultimately use the state CRM to collect additional data and then report that locally as well as to our partners at SAMHSA and Vibrant. So take a quick pause for any questions from the board on the 988 update.
I have a question. Thank you for the update. A lot of information. Sounds very busy. You referenced perhaps that there's a timeline driven by SAMHSA. Are there any more details on that you can provide?
So we're hoping to get that next week when we sit down with John and really work through that. Again, the MOU was just sent to them, so I don't know exactly what coordination there's. As you can imagine, with the change of administration, there's been some changes within SAMHSA. So I think they're working through a lot, but we have not let up on our conversations of trying to drill down and get a timeline.
Thank you.
This
Any
is
other-
Lan with just a comment and a question, Paul. So I'm excited to hear that the MOU has been signed, at least on California side. Now just waiting for SAMHSA or someone from Vibrant to sign it. So so assuming that they will be signing that MOU within a few weeks, what does timeline look like as far as the implementation of the routings, 98 calls, and all of that stuff? Do you have something like that in mind?
So for the timeline, we're continuing to work with SAMHSA. John and James at SAMHSA has been our point of contact. We're meeting next week, and we're going to be talking about specific timelines. When I spoke with them last week, they were excited about the MOU signature. They were prepared for it and getting ready to act on their side. But to specific dates, I don't have those yet. And as soon as those are available, we'll make sure to share them with this board and then, of course, all of our 988 centers through the state.
Thank you.
Okay, do we have any public comment related?
Sorry, I have one more question.
I'm sorry.
If I'm remembering correctly, there was a contracting process going out for the mobile response, like a second one beyond the initial CRM. Am I remembering that correctly? Are there any updates on that?
So the mobile response contract we held. We felt it was premature, especially as we continued to develop the 5-year plan. We are positioned. We've got that contract. CDT's aware, and as soon as we get some more details from the 5-year plan, we've identified who's going to dispatch the mobile crisis response teams. Then we'll be able to get that contract action going back again, get that technology developed. What we feared is we were premature and we didn't want technology sitting stagnant, not being used, not being maintained, not being updated. So we want to be able to get good, fresh, solid technology deployed when we're ready.
Makes sense. Thank you.
Any other comments from the board? Any comments from the public related to the 988 report? Hey, thank you. The additional item I did want to talk about is the surcharge. I believe this board is new, and I just wanted to make sure to refresh everybody's knowledge on the state's budgeting process. When 988 was developed, the surcharge was set at 8 cents for the fiscal year 23 and 24. This fiscal year, we will go through the calculation exercise that we do with 911. And these talking points are really working through what that calculation exercise is And we'll keep this as a static agenda topic just to make sure everybody understands the budgeting process. So in about June, the 911 branch team will send a letter to all of the access line providers in the state. And that request is the provider to respond with the amount of access lines each provider has. We collect that data, and then we take the approved governor's budget after the fiscal year, and we take a look at what budget authorization we have. And then we do a calculation of how many access lines, what is our budget authorization, and in there we use numbers off of this fund condition statement. So this is our last fiscal year 24-25, or our current fund condition statement. So on the far right column at the top, it shows a $13 million beginning balance. That's the estimated carryover that was projected from the budget. In the new fund condition statement, it'll show likely a refined number. And then we'll take a look at what is the budget authorization. And then from there, we go through a calculation to see what is our authorized expenditure, what is the revenue needed to cover that expenditure, the number of access lines, and then the spreadsheet that we use calculates what do we need to recommend the rate to be set at. So that budget cycle for us has started as the governor's budget has been drafted and it's working through its process. And when it gets approved in July, we'll pull that newest fund condition statement. We'll be well into the request for access line data from the carriers. And then through the month of August, they have until the end of July to respond to us. So through the month of August, we'll go through all of this math. And likely in the August meeting, we'll have a drafted sense of where the budget is. And then we'll work through the rest of the process. And then by October, Cal OES needs to respond to the California Department of Fee and Taxation, CDTFA, with a letter recommending what the rate should be set at. So again, we do this for 911 and now 988. This exercise will occur throughout the summer. So I'll take a quick pause and answer any questions related to the way the rate is set for 988. Any questions from the public related to the rate? Okay, thank you. Our next item on the agenda is an update from CHHS. And I'm going to pass the clicker here over to Dr. Bowie.
Okay, so let me walk you through. Where do I put this at? Fantastic. So the last update we provided was in August from Cal HHS. So we have about 6 months to catch you up on. I'll try to do that in not too long of a time. But I did want to highlight the milestones and the projects. The project highlights. I did want to walk you through the organization and structure of the 5-year implementation plan, including a little background on the development of it, understanding that some of you are new, highlighting the goals and recommendations, as well as activities where Cal OES has been specifically named as having a role as a state lead or implementation partner, and some preview as to next steps. Okay, so in January, the Cal HHS did submit the 5-year implementation plan and supplemental materials to the state legislature. This was required by AB 988. So on our website, as well as links here on the slides, you will see 3 documents. So the first one is the 140-page document that is the 5-year implementation plan. It does have an executive summary, and there are tables for recommendations, so that hopefully that is easier to read. I'll walk through that with you in just a little bit. I just want to highlight the other 2 supplemental materials, which is one is called the AB 98 chart book. One of the mandates in AB 988 was that we conduct a comprehensive assessment of the crisis system. And so what this is a snapshot in time, actually, of where California is at in terms of both behavioral health needs, as well as data that we were able to gather from publicly available sources, as well as sources from our departments, such as Department of Healthcare Services, the Department of Public Health, HCI, EMSA, and others, to give a view of where we are at in terms of the crisis system as we try to envision it, from having someone to call, someone to respond, and a safe place to get help. So really kind of a span of where the warm lines, hotlines, the existence of mobile crisis teams currently, as well as the crisis receiving and stabilization facilities. In any case,
Just one question for clarification before you move forward. So all 3 of these were submitted to the legislature last month.
correct.
Statutorily, is it just informational for the legislature, or is there some sort of approval mechanism built into the statute?
There is not an approval mechanism. We just needed to submit it.
Okay, thank you.
So the first 2 were required. We also just submitted the community engagement report, just to outline what we had heard from individuals with lived experience, so that we could understand better what we needed to do to improve our crisis system to meet the needs of people who need the services. So those are the 3 documents that are available now. I do want to highlight that if you downloaded the plan last month, it has a number of typos and formatting errors. So just as of February 14th, which is last Friday, we did go ahead and replace that online version with a corrected copy. So if you wanted to reprint it, now is a better corrected version that's online right now. Okay, so if I may walk you through what we did to get there. So at the top is really getting to that legislatively required set of recommendations for a 5-year implementation plan for a comprehensive 988 crisis system. We had a year to do it, and how could we get the most collaboration possible? So we structured it through the policy advisory group. We worked closely with the technical advisory board members, as well as a number of state agencies and the task force on behavioral health. We had a work group, kind of division of labor, because there were 14 required topics to be tackled. So we had 7 work groups working to really provide some expert analysis and recommendations. We also held a number of interviews, surveys, focus groups, as well as really invite a number of collaboration from across the state. So in summary, we had 7 public meetings of the policy advisory group, which comprised of 43 members. We held 21 public meetings of 7 work groups, which comprised of 140 members across the 7 work groups. We held 13 focus groups with people with lived experience. That was a total of 90 participants, and held over 85 interviews. Still more needs to be done because this is a huge undertaking. So in fact, we invite further comments, and we are more than happy to go and speak to particular groups or your communities or teams or committees to present the work, and certainly solicit more input from everyone, because this is a work in progress. This is really kind of the beginning, right? We've got a blueprint of mapping out what we want to build. But as you know, all projects need to be tailored in the moment and adapt to the needs. So happy to continue to speak about this. All right, this just gives you an outline of the meeting dates of the policy advisory group. If you wanted to, you could go back to our websites and take a look at what the work groups discussed, as well as the policy advisory group discussed. The slides are there, as well as recordings. I did want to highlight that we held 2 public comment period for the implementation plan. That was back in November for 2 weeks, as well as later in November into December. So 2 separate public comment periods were held for this plan. This is just a process timeline that mapped out when the work groups met, what we did. Really, work groups met over the spring and summer, as well as some of the milestones that we had to achieve along the way, including summarizing the community engagement report, getting findings from the comprehensive assessment, and ultimately getting to the final plan, incorporating in public comments. Just want to kind of revisit where we are in terms of, so we've got, stuff on paper, but what is really happening and how do we really start to think about operationalizing? So again, using the model that Samantha has put forth in terms of someone to call, we do have 12 988 crisis centers in California. This is in the context of over 200 plus 988 crisis centers across the nation, several of which function as national backup centers. So because none of our centers are really truly up to capacity yet in terms of meeting the needs, there's always going to be a lag. So there's that kind of national backup that is needed to make sure that calls are answered. We can dive into that a little bit more, but I just want to highlight the fact that California answers the most 988 calls out of every state in the country. About 1 out of 10 988 contact originates from California. And as we move to geo-routing, I think we're understanding a lot more where people are calling from, at what location. So that's helpful for us to think about what the needs are in our various communities. Do want to highlight the fact that we've been building out mobile crisis teams across the state for the last few years. And we are aware of at least 450 mobile crisis teams that meet the Medi-Cal mobile crisis services criteria, which at this point for us is the gold standard in some of being peer-based, community-based, decreasing reliance on law enforcement, reducing unnecessary law enforcement, as well as hospitalization. So all those goals are there in those mobile crisis team, but just keep in mind that we only just started that mobile crisis Medi-Cal benefit in January of 2024. So at this point in time, that benefit has been implemented in 49 out of our 58 counties, and that's serving 99% of Medi-Cal members. Our Department of Healthcare Services is working actively with those counties that need some extra support to get these teams up and running. Keep in mind that we don't know exactly how many teams we need yet. So there's a whole kind of work with SAMHSA. SAMHSA just put out a mobile crisis toolkit. So we are working to look at national standards as well as methods of surveying how many mobile crisis teams are there, what types of mobile crisis teams are there, and how do we account for them, as well as understanding the models of what is needed to respond to community needs. So that is really, I want to highlight that is a big part of what we're gonna be working on very soon after this plan was submitted. We were able to really, I think, structure how 988 could be supported ongoingly by the state and the funds that are coming out of AB 988. We have not yet figured out how to do it statewide. for mobile crisis teams. So that is a work that will be coming in the future that you'll be hearing about shortly. We'll put out a work plan soon. All right, so going back a little bit to the development of the plan, at Cal HHS, we really envision this as the comprehensive 988 crisis system. So we really wanted to put out what the state envisions in terms of the future state of crisis system, in terms of making sure that there's consistent statewide access, there's high quality crisis services available to everyone in California, regardless of location, insurance, or any other individual characteristics, and that the crisis services need to be coordinated across the continuum. The implementation had certain foundational principles built into it, again, reiterating what we're thinking of in terms of just the 988 system of statewide accessibility, 24/7 therapeutic services, and then really 988 needs to be integrated and connected to a crisis care continuum that really plugs people into immediate and ongoing support so that they don't need to go through crises again, hopefully. The way the plan is structured is around 4 fundamental questions. So you're going to see everything drives toward the questions that we are asking really from the vantage point of the help seeker. Will the help seeker know who to call? We have a lot of warm lines, hotlines, lots of resources in the state. And what are some things that we need to do to both increase public awareness and trust in the 988 system, as well as really there shouldn't be any wrong 3-digit number to call or any wrong number to call. So how do we message that and make sure that it's not confusing to the public and that is clear? The next question that we really aim to answer in the plan is, once the help seeker does call a 3-digit number, will they be connected appropriately to the resource that they need? And to do that, if once they do call 988 or connected or transferred to 988, will they get a high quality 988 service? And what are some statewide standards and training and oversight that we need to set up in order to ensure consistent quality services in 988? And then the last question, I think I mentioned that several times, is will the help seeker gain access to immediate and ongoing care? So how do we integrate 988 into the full continuum of behavioral health and crisis services? So those are, you're going to see goals A, B, C, D, trying to answer those 4 questions. And then you've got goals at the bottom that really are cross-cutting. So equity goals, data and metric goals, funding and sustainability goals, as well as integrating peers. Those really go across the 4 pillars of what we're trying to do in the plan. Should I pause for any questions, any clarifying questions?
Yeah, but we can ask for questions. I know that this has been a lot of content.
I know it's a
Yeah.
lot to go through.
Yeah.
I don't think I need to, yeah, let me pause here and see what we need to do to clarify further.
Are there any questions from the board up to this point in the briefing?
I have a question. Could you talk a little bit about how the texting option for 988 is routed through this? Or I don't know, maybe that's a question for later, but I guess I'm not sure which agency lead that directs to, but in terms of if 988 comes through a text, so go to that call center, and is that connected to our resources that we're implementing here in California, or does that generally go to a backup center?
Currently, California is still ramping up chat and text capability, and anyone who's working at a 988 center, please feel free to chime in. So we are not yet at full capacity. I believe we're answering about 30% of chats and texts that originate from California at our 12, well, only 9 out of 12 988 centers have chat and text capability. Because of what we're trying to do, we're kind of in this interface between using the Vibrant chat and text platform versus thinking about what we're going to do to transition to the California system. So currently we're using the Vibrant chat and text platform. We are ramping up capacity. No matter what we need to do, we do need to ramp up that capacity. And then I'm going to hand it to someone who knows a lot better than I do, which is probably many of you.
Thank you, Dr. Bowie. This was a conversation that we had with the 988 centers when Kurt and I visited. That's an ongoing effort to increase capacity at the centers. And Kurt and I actually have a meeting this afternoon with the text and chat folks to further discuss how we bring text and chat into the state, and we continue to support growth. So to your specific question, I think in May we'll be better served to give a little bit more detailed report out on that. But I will say it's not lost on us that we need to be able to support that technology and to be able to give advanced technologies to our centers, especially for those that are working remote, to be able to support text and chat.
Thank you.
I would like to mention that there are, Well Space Health being one of the centers who do offer that service 24/7. So we do have centers who are capable of doing it 24/7 while we're bringing others along.
I just have a comment on that. I know that in our center it is live, but not with all PSAPs. And basically what happens is the text originally goes to the PSAP wherever it's basically plotting. So it's plotting on the freeway, then it goes to CHP and then or PD or sheriff, and then that's when we get routed the text to 911 on rapid deploy, and then we then start texting and get the information from them, and then kind of treat it as a phone call, and then try to get them on the phone, and then try to, and then from there you determine what's really going on, if it's just a police matter, if it's just, and then in this case, if it would be just a 988 matter, and then route it appropriately, or just obviously dispatch at that time. So.
And I think to that point, 911 has had a little bit longer to kind of develop that texting capability. And I know over the last 15 years, 17 years that we've been taking text across 911. The 911 industry has refined that. And I think that's what we're trying to do in 988 is to be able to further refine enhance the capabilities, especially when it comes to chat, because it's not just text. Texting is very easy on this device. Chatting on a computer is a little bit different. And I think I look at when text first came into the industry, how difficult it was to route. And I think we're seeing that same challenge on chat through a computer, through a non-smart device. So we will be working hard to improve those services and hopefully make better capabilities and easier for the centers to be able to staff and get those texts and chats answered.
I have a question for Dr. Bowie. You had mentioned the discussion about no wrong number to call. Obviously, the idea is the person seeking help can reach a number and they will get the help they need because of the interfaces and the education, et cetera. Is there an effort? I know in my region, the 988 center that serves my region, they really still rely heavily on the 10-digit number that they use for the like for suicide hotline, because it's been so well established for decades now. The discussions or the efforts of trying to centralize that as much as we can, because obviously 988, a single number that I can access or anybody can access throughout the state versus knowing a 10-digit number in one area versus another, and how that plays into this strategic plan. Because I know for me, when I continue to talk to a variety of people in a variety of different spaces, The lack of awareness of 988 is still astounding to me, that we've come this far and people haven't even heard of the number. They're not even aware that you can get that. So I just, if you could briefly maybe kind of clarify how that plays a role with the various numbers that are still out there in use.
Yeah, thank you. That's an important question. We do not yet have a statewide communication plan about 988 in California. We need to and really reflect and think through those kinds of questions that you've raised, right? It's only been a couple years since implementation of 988. The 1-800-273 talk of the National Suicide Prevention Lifeline is still active. If you dial that number, you'll still get to one of the 988 center. So yes, there are lots of numbers out there. We, in our implementation plan for Goal A, we want to talk about how do we build a thoughtful communication plan about 988 in California to meet Californians' needs, and understanding that it's going to likely vary by region and by populations that we're trying to reach. So that is going to be tasked to the Department of Public Health, who understand about public communications, as well as having a strategy to study the effectiveness of these communication strategies in terms of both increasing awareness, trust, and behavior change, and see if we can impact the rate, say, of suicide or overdose in our state. So that's one part of the strategy. And I guess the other part is syncing up with what has been done nationally, which there has been a national campaign on 988 awareness, I guess from summer of 2024 until actually still going on now. So there's a lot of like pieces that we have to coordinate. Yeah, but all those are fantastic questions that we got to keep in mind.
Thank you. Appreciate that.
Dr. Bowie, when I'm trying to reflect back on the original budget request that established and authorized, there was AB 988, and then I think subsequent budget asks, did any of those contemplate the communication strategy or a campaign to push the messaging out across communities and raise awareness on 988?
That is one of the 14 required topics that we had to address in our AB 98 implementation plan, and then subsequently there were revisions to AB 98 in AB 118, the Budget Act, that changed some deadlines and had some chairable bill.
So we're not
language.
sure whether there was a specific appropriation for that activity, though. And that's okay if you don't know. That's interesting. So CDPH is in charge of the messaging campaign under the Cal HHS agency.
That is what we're proposing in the AB 988 implementation plan that we submitted.
If we had a magic wand, I mean, you folks are closer to this topic than I am, but if we had a magic wand, if we were to launch a big messaging campaign, are we at the space right now in the project that we would do this now, or would we wait 6 months from now? What would be your the perfect time to do that, would you think?
So the implementation plan, year one starts July 1st of 2025. But we want to plan for these activities.
Okay.
We've been planning for these activities this whole time, right? It's just a question of where we're at in terms of what stage of planning we are at. Certainly, public safety communications has a large role to play in, and you're named in the communication plan. Like a lot of people have to work together to think through this.
Okay, great.
Yeah.
Thank you.
Yeah.
If I can offer something, so a number of the county behavioral health directors, including ours in San Diego, have had a lot of reluctance to advertise 988 until the geolocation-based routing goes into play. So that I think is going to be a critical timeline, because they want to make sure that someone reaches out to 988 in their
Right.
county, that it goes to their county
Okay,
services.
that makes a lot of sense. Okay, that's helpful. Thank you.
And georouting is about to go live with AT&T on early March 4th, I believe. So that's the third major carrier that's going to go live with it. So if I may skip through the next several slides, because what it just lays out the four pillars and what the recommendations are. And I'm just going to go to the implementation activities level, because that's going to help us think through what we need to do next to really operationalize. So there are a total of 16 recommendations in the 5-year implementation plan. Cal OES actually has a role in 14 out of 16 recommendations. Sorry for all the work that you're going to have to be doing with us. Out of a total of 65 potential implementation activities in the next 5 years, Cal OES is state lead on 20 implementation activities, often with other state partners. So no worries, you're not doing this by yourself. We'll be right in there with you and several other state partners. And then Cal OES is implementation partner on 21 potential implementation activities. So what I did in these next slides, and I apologize for the small print. So I'm just going to walk you through what this is. So this is goal A, right, having to do with public awareness. And under each goal are recommendations that the Policy Advisory Board has put forth in terms of what the state should really consider doing. So for example, under recommendation A1, it's recommended that that there's coordination of state behavioral health crisis communication strategies, and that all that is informed by the national administrator, so that we can coordinate what's happening at the national and the state level. And then what we've got there underneath each recommendation are a set of potential implementation activities. So these are things that state partners have talked through in work groups with each other in the policy advisory group to identify specific activities that we should do to operationalize that recommendation over the course of year 1, year 2. So you see the activity in that first big column. You see the state lead in the next column. So for example, under communication, I mentioned that the Department of Public Health is state lead. And then obviously they need implementation partners. This is not an exhaustive list of implementation partners. This is just some of the key people who have stepped up and agreed to work on it together. And then you've got kind of asterisk in terms of what year we're envisioning doing these kinds of work. So hopefully that helps you to see. So, and what I've done is I went through and I highlighted in yellow where Cal OES is named as a state lead. And I highlighted in blue in the second column where Cal OES has been named as the implementation partner. And I hope this serves as a blueprint for how to kind of map out a work plan for the next 5 years. So as I mentioned, so we've got, I don't even know if I'm pointing in the correct place. Is it up here? Okay, got it. So A was communication, B is around infrastructure and technology, and it's not surprising that Cal OES is lead on 2 of the recommendations. Recommendation B1 having to do with supporting the technology to route 98 contacts safely and efficiently anywhere in California. And then B2 having to do with promoting coordination and communications across state technology implementation partners so that we can align technology, policy, and practice. So I apologize, I'm not going to read out the implementation activities, but this is kind of give you an overview of what to look at when you look at the plan. The high quality 98 response that falls largely under the Department of Healthcare Services in order to ensure the proper training, TTA, statewide standards, and setting up a system of state oversight in working with 98 centers, keeping in mind, of course, that we really want to align with federal standards, national standards being kind of really the foundation of where 98 centers have to be because they have to meet certain national standards. And then what the state needs to do is think through what do we need specifically as a state for various populations of focus. What standards will we need to set from a statewide level to make sure that the 98 centers can meet the needs of Californians. So that's just the rest of C is, again, ensuring a statewide standard, high quality 9.8 services. In integration, it's a very, very key thing. You see that several state partners really need to work together to think about coordinating with payers, providers, and cross-sector partners so that individuals in crises can connect to immediate and ongoing care. In terms of equity, there are a number of major activities that we need to think about. I want to highlight the fact that our tribal communities brought up several times the need for us to think through whether a specific 988 subnetwork that is staffed by and to answer the needs of Native Americans would be something that we can set up in the state. So that's something that we're just going to explore and look at. And then there's a number of activities, obviously, around funding and sustainability as we move toward the 98 fund being likely the primary source of sustaining 98 centers and related crisis services. We have a lot of work to do in terms of setting up statewide data and metrics. As we know, 98 centers report on at least 200 plus data points on a monthly and quarterly basis to meet requirements that have been set up by SAMHSA and Vibrant. We have to think through what state standards, measures and benchmarks we want to set for our state to make sure that we're meeting the needs of our populations. One of the things I want to highlight is Cal HHS is mandated to report annually on the progress of this implementation plan. And as part of that, we intend to build a data dashboard that is public facing so that there can be a snapshot that is hopefully easily understandable. We have lots of dashboards out there, but they're not easily interpreted by the public. So we're hoping to build such a thing so that we can really take a look at how our 988 crisis system is functioning over time. So that's another goal for us to work toward in the next 5 years. Okay. We definitely want to integrate peer support across the crisis care continuum, and that is a very a high priority for our agency. Want to highlight the fact that we've got all these wonderful state entities now working together. They were named in AB 988 with the exception of EMSA. So we're asking that EMSA is part of the assurance that there is standard statewide medical protocol, whether people call 988 or 911, they'll get the same kind of medical triage that they need. But in any case, this is just kind of an outline of what the various state agencies will be doing together. So this is just a table of what are some of our next steps. And I apologize for the small print. But again, I think just want to highlight that for our agency, Cal HHS, we need to do annual updates for the next 5 years on progress of implementation of AB 988. We play a role in coordinating and supporting state entities. We want to do that public-facing data dashboard. And we need to work on mobile crisis. And I think a few other highlights, Department of Healthcare Services will be working on a state designation process for 98 crisis centers so that there's clinical quality assurance as well as support, training, all that good stuff. And I think that will be really it. If you have any questions or feedback, please contact the email address, ab98info@chhs.ca.gov. Really want to reiterate that we're more than happy to come talk to your team or community. So please let us know. And then if all goes right with the budget process, we start implementation July 1st.
Thank you, Dr. Bowie. At this time, do we have any questions from the board members regarding the HHS report out. Do we have any questions or comments from the public related to this agenda topic? All right, thank you.
Just want to
Next.
thank Dr. Bui for sending us the information for the advisory board members who would like to also present the updates of the 5-year plan to their own community. That was very helpful, Dr. Bui.
Thank you, sir.
Thank you very much.
All right, next we have SAMHSA, FCC, and Vibrant updates. As I had mentioned previously, the MOU has been signed. We continue to work with SAMHSA. One of the things that we're focused on from the Cal OES perspective is we're establishing regular meetings with the SAMHSA and Vibrant team. Again, they've had a little movement in their leadership there, so we're engaging with them and getting the appropriate folks to the table to continue discussions and collaboration for California. As soon as we have additional details about timeline and the 988 deployment plan, we'll definitely report that out and share that with all of our 988 centers and get them prepared for that deployment. From the Federal Communications Commission, they did have for 988 geo routing, FCC-24-45 is a notice of proposed rulemaking where the commission continues to work to provide meaningful access to 988 Lifeline. The FCC has proposed to adopt rules which will require the wireless carriers to implement geo-routing solutions for the calls to the 988 Lifeline system. And then 988 outages, FCC D. David A. Adam 24-1206, effective April of 2025. Similar to the 911 outage reporting, this docket will require carriers to report outages to the Commission's network outage requirement in the Network Outage Reporting System, or NORS system, for outages that affect 988 Suicide and Crisis Lifeline. And that is a good first step for us to be able to track the health of the 988 system, especially as we start to integrate those calls across the state's platform. And then with Vibrant, one of the things that I'm really focused on is as we develop that SAMHSA relationship, I'm finding those appropriate members within the Vibrant team to be able to build and continue the ongoing support for California from the Vibrant side. And we'll be working with SAMHSA next week to start that outreach and create those regular meetings with the Vibrant team. So I'll take a quick pause for any questions from the board related to this agenda topic.
Thanks, Paul. The question I have is about the go live dates for the geolocation-based routing. It sounds like, as with the number itself, some of the carriers have sort of gone ahead and to implement this once they saw the direction that FCC was going in. At this point, do we know what percentage of carriers or what number of phone lines across California are connected via georouting versus the area code? And where I'm going with this is, as we do more public awareness or as people reach out and ask questions, I want to be able to give them good information on where their 988 call is going to connect to.
I have not started to analyze that specific data, but I'm taking an action item for the team to start to look at geo-routing in California and see if there's a way for us to be able to analyze, probably be easier with our wireless callers. On the 911 side, we're showing about 87% of the 911 calls in California, just over 25 million, are coming from a wireless device. So I would assume that we'd probably see that same percentage in the 988 workload. Not a lot of people have the traditional landline there's a lot of VoIP lines, but it's still only about 6% represented across the state's workload. So let me take that as an action item and see if we can drill down into that and start to track that.
Thank you.
I think I know a little bit. At least I heard that at least the go live so far since September, was it, with T-Mobile and Verizon? That's about half the carry. I guess it covers half the population that has mobile devices. And then I guess AT&T has kind of a fairly large customer base. And then I guess there's a number of smaller carriers that will cover the rest. Vibrant did send us a georouting impact analysis for California recently with what AT&T Go Live would look like. And it looks like it's a mixed picture. It looks like the volume will go up for 5 centers in California and will decrease for 7 centers, resulting in a net minus 0.9% of call volume change in California. So that's actually good news for us because it's not terribly disruptive. But in looking at the individual 988 centers, it varies anywhere from like a percentage to maybe almost 7% volume change. And that can be quite significant depending on the size of your 988 call center. So I think that's something to listen to at Go Live, which is going to be in 2 weeks.
All right. Thank you, Dr. Bowie. Any questions from the public related to this agenda topic? Right. Thank you. Our next agenda topic is a discussion on the 911-988 transfer guidance document. And Jeff, if you can provide an overview, your understanding from the NINA's transfer document that they've just published and how it would relate to the document that your group has started to work on.
Sure. Thank you, Paul. So as I said earlier, I wouldn't consider myself an expert in the document that Nina published, but I have reviewed it enough to at least do a compare contrast for what our 911-988 interface working group has been working on. The National Emergency Number Association, they published the document, and I think it was ANSI approved in late January, so it's very recent. The document number is STA 045.1-2025 for those who are interested in looking it up. You can also just search online for NINA 988 911 standards document or something like that, and it should be easy to find. In reviewing their recommended standards, the high overview of what's incorporated in it is it makes recommendations, obviously, because it's an organization that focuses on 911, NINA being the organization that focuses on 911 nationwide. Obviously, it's not going to be a one-size-fits-all. But the recommendations that they include in the document are the need to establish MOUs between PSAPs and 988 centers, outlined information for what information will be shared between 988 and 911 when transfers occur, transfer processes and considerations, for example, warm transfers, not cold transfers, things like that. Recommendations for addressing how translation needs would be addressed. So when you have an other than English speaker who calls in a 911, the PSAP gets a translator on the line, or maybe even the dispatcher that answers that call is bilingual, how that handoff to 988 when appropriate would be handled with that translation need. Handling situations of co-response. So that would include when law enforcement, fire, and or EMS are it's necessary for them to respond, but 988 is also handling the call, handling and talking to the crisis, the person in crisis, or for those areas that also have mobile crisis response teams available, and how that managing that co-response and what that looks like. The need for PSAP documentation and tracking of transfers to 988, so capturing from a statistics perspective. The good thing I think for us in California is since the way we are deploying 988, we're already capturing a lot of the data, especially with the next gen 911 integration. But talking about the need for PSAPs to document the handling of the receipt of that call and the transfer off to 988. And then a section on considerations for training of 911 staff, the staff that answer 911, the dispatchers in PSAPs that answer 911, the information that they're going to need to better handle those calls for the handing off. So that's the broad overview of what the NENA standard document covers. It also includes sample MOU, sample SOPs for PSAPs, and other considerations, which make it a little easier. I think for many PSAPs and for 988 to look at, well, what direction we should be going. So again, that's what's involved in that document. To your question, Paul, for what our interface working group has been working on, we've been in that direction, covering a lot of these things, but I think there's a lot of topics that have been included in the NENA document that we really hadn't considered or thought of, or maybe built out enough. And so that's where I think that we could take our existing document that was presented to the board last year, and then maybe look at the NENA standard and see how we might be able to refine that, unless the board wants to go in a different direction. So with that, I'll pause there for any question or discussions, but I have some additional questions that I think the board needs to consider and weigh in when we are in collecting your thoughts as a board, what the interface working group should be focusing on for refining that the set of processes that we put together.
Any questions or comments from the board?
Thank you so much for bringing that up, Jeff. It was really kind of timely that the NENA 911-988 standard came out. We knew it was coming because Leanne Migalski told us it was coming, so we were really eagerly waiting for it. I totally, fully support having more using national standards in developing anything that for our state. I know it's just a state guidance document, but I just want to emphasize the fact that anything the state puts out, even as just guidance and not dictating local protocols or anything like that, has a huge impact. Just the fact that you've been working on this guidance document for the past year has generated a fair bit of very local responses. We're fully aware that our 911 partners need help, certainly with behavioral health crises. The question is, how do we do this in a thoughtful manner? I think highlighting the difference between the number of calls to the 911 system versus to the 988 system. We did some back of the napkin calculation about what it would look like, even if you started to think about transferring up to 1% of behavioral health related 911 calls to 988. How do we do that in a thoughtful, stepwise manner that wouldn't break the new 988 system that we're building, right? So I think using national standards will be super great. I haven't had a chance to read this closely. I did look at the NENA standards for transfer of suicide-related calls. I can't remember exactly what that's been around for a little bit longer. And I was hoping to think about what's the next step? So could we think about, if we were going to pilot anything, we want to do it in a stepwise fashion, right? So if you were thinking about transferring 911 behavioral health 911 calls to 988, why not think about suicide-related calls that are not a public safety risk? That's more easily defined than behavioral health crises. Second, it really builds upon the expertise that 988 centers have been building for the past 25, 30 decades, right? That is fully their expertise. They are the national experts on suicide crises. And so if we piloted that, I think we have a greater chance of success and understanding what that looks like. If it first decreases the immediate burden on our 911 center, but also capitalizing on the strengths of our 98 centers and really reducing it to a manageable, I don't know about manageable, sorry about that, but at least a defined set, right? Because right now, I don't know how we're going to define what behavioral health crises to transfer, but suicide related calls, I think we can define that much more easily.
And to that point, that's been the struggle within our working group in those discussions because it is so broad, and from the PSAP community, we look at it from a very, very broad perspective, and because dispatchers are trained public safety professionals, not necessarily behavioral health professionals, they just see it as, well, it kind of ticked that box, so let's go ahead and call it a behavioral health crisis. And so that I would agree with. We could focus specifically on suicidal or suicidal ideation, those kind of things that are easier to define. But then I think we get to some of the other minutia of the technical aspects, Paul, that I think Cal OES needs to answer, because it would be very easy just to say, if it reaches this type of call, came out of 911, the dispatcher at that PSAP should transfer to 988. Well, what does that look like? And we have some technical, we're the technical advisory board, and I think we need to address those things. Are we doing 3-digit transfers, which I think are right now not possible? Is that correct? Like if I get a call on my 911 trunk, I can't 3-digit transfer to 988, right? I'm gonna have to do a 10-digit transfer.
I believe it's got to be a 10-digit transfer today.
Right. So that
Yeah.
now adds a level of complexity for the PSAPs, because some 988 centers we know cover multiple counties, where we have one 988 center that maybe handles, their county. And so now that's going to vary from region to region. And what happens in a PSAP that has 2 dispatchers working versus maybe 30 dispatchers is also going to change that. And so those are some of the other things I think that we're going to need, if we, to Dr. Bowie's point, if we want to move towards starting to transfer these calls off from 911 to 988 for better handling, which I know the PSAP community fully supports. We're going to have some of these other technical answers handled. So we would talk about like the text to 911. I get a call, a call, but a text to 911. Now, how am I handling that if the 988 centers are not equipped and ready to handle that? Am I just relaying the information verbally? Does the dispatcher continue the interaction with the crisis seeker? And so that's where I think there's some unanswered questions for my working group we can say, yeah, transfer this kind of call, but now the question of how needs to be answered, so that the person seeking assistance is receiving the assistance they need in a timely manner, the right assistance, and it doesn't complicate them receiving whatever that level of assistance is.
That's a lot.
Yeah, I know. And I don't want to imply that I think we need to decide all that right now, and I think probably need to work with your staff for some of that. But I think I want to bring it up to the board's awareness, because I think it is sometimes simplified as we need to start transferring calls. Well, it's going to involve a lot more, especially with the number of PSAPs that we have throughout the state.
So a couple of points you made, I have some action items that I want to go back to my team and discuss. And Dr. Bowie, you talked about kind of a pilot starting phase 1. How do we look at taking 911 suicide callers and getting them into the 988 system? So I think what we can do is, with your working group, maybe we could do some outreach and start collecting some thoughts from Dr. Bowie about how we can frame this up. And then what do we need? What is the NINA document address? What is your document address? How do we start to frame this up? And I'm looking at Kurt. Can we try to facilitate a couple of meetings before the May meeting to frame this up as an idea to brief out in the May meeting in this agenda topic? Is that
I
feasible?
believe that's feasible. And are you suggesting that that would also start to address these technical issues to facilitate the process or the
Yes.
procedures? Okay.
Yes.
Yeah, then I think we could do that.
Yeah, I've got a couple of action items here. I want to get NGA. We'll be meeting with them this afternoon, so there's some technical nuance I want to address with them to make sure that I understand their technology.
Mhm.
And then the integration of the system to both the legacy and the next gen 911 network where it's deployed, make sure that we can meet those challenges. And then I want to bring Ryan Sunahara from our team into this. He's the branch's smart guy when it comes to how all of this is going to work. So I want to make sure that he's brought to the table.
Yeah,
as well.
absolutely. And I think those discussions need to be separate from my working group only because it starts to bog down. So Kurt's an amazing resource and he always is able to answer my questions. Even when it's, I don't know, he's really good about actually answering those. But I think that, like you said, with Ryan's technical assistance, and we are going to need to engage NGA as a platform because there's a lot of the things that I worry about making it technically possible to make that transfer happen. Because like I said, I think sometimes we gloss over or we oversimplify, hey, we need to transfer calls. As many know, it's a lot more complex, especially in the 911 space, to make those kind of things happen effectively, especially with the nuances of 988 when what happens when the center is overwhelmed and busy. So what the delay look like for the crisis seeker, and does that fall back on now the 911 center for handling that call and things like that?
And we haven't even addressed the training side of this, as I look to Jamila as our training expert. We all know change could be difficult, and coming from a PSAP background, introducing a new workflow or change of policy requires a lot of effort. The local PSAP is going to have to make sure that they've got the training resources they go through, their staff is trained, everybody understands the operational policy. And then I think to your point, Jeff, the technical training aspect of it. How do I now do this? I understand I have to. Now what do I do? And then I think there's probably some outreach from the local PSAPs, especially our larger PSAPs, where I think more of the workload is going to go, to make sure that we've got a clear understanding between the PSAPs and their local Lifeline crisis centers. And so we've got some work to do. So I've got an action item. We'll work with Kurt. We'll coordinate with you and Dr. Bowie to get some meetings scheduled so we can start to frame this up. Hopefully at least get a good skeleton for the May meeting and maybe start the broader conversation. And
Sounds good.
were you gonna make yes, sir, go ahead.
Yeah, I just want to add that some of the 988 centers already have some of the call transfer from 911 to 988. And there is, we created a designated backline phone number from 988 centers that 911 can use to transfer to. I know that Seneca has been doing that in the last several months, and DDoS has been doing that for a number of years. So yeah, so we would love to have that discussion about how to create a process that make it seamless and effective, because we've learned over by doing that, about the glitches that needs to be fixed and so on. So we'd love to have that conversation. I'm just wondering, Jeff, is there a way to have access to that, to the NINA number 188 standards that we can take a look at, or is it something that's still in sort of like in the development mode. I'm
No,
not sure.
it's publicly available on the NINO website. They have the website or a webpage that's dedicated to the standards they publish, so it is there. You can easily find it by searching online. But
Oh, okay.
I would
Oh, great.
I would ask Paul that maybe we do make it available or connect it to the I don't know, the Cal OES page for 988 for
Mhm.
this board or whatever you think is appropriate.
Oh,
So as you were just talking, I made eye contact with Dylan. What we'll do is we'll get the document downloaded. I believe it's in PDF format.
It is.
I'll have Dylan distribute to all of the board members, and then we'll work with our local IT team on the Cal OES 988 page. We'll put a link to that PDF document so it's available easily through the Cal OES site. And then as your document matures and develops through a more robust draft, we can do the same and link it there.
Mhm.
So both resources will be made available to the board, and then it be presented as a board packet for the next meeting.
I
thank you
just
so
wanted
much.
to, I just wanted to emphasize Jeff's point to the technical complexity that might be involved in transferring. At DD Hirsch, as we've extended 911 rollover, that's what we call the program, to multiple PSAPs. One PSAP was able to configure their system so that when they do the warm transfer, our system sees the ANI, the phone number that's calling, as the help seeker's phone number. For some other PSAPs, they weren't able to figure out how to get their like upstream carrier to pass on that number. I don't know if it's like a limited resource beta, like different, but what one of the issues, and the 911 folks know this better, is that some PSAPs might be using like different vendors that
Yeah.
have provided.
That's
their
definitely
system.
a contributor.
And so when we said, hey, PSAP, where this is working, can you please talk to this partner where they can't figure it out? And they're like, we're on different systems.
Mhm.
How we set it up doesn't work for them. So right now, as we're receiving calls from partner PSAPs, we are already very much bottlenecked by this issue of when they do a transfer, we don't know the help seeker's phone number. It's not displaying, and we need to take some time to collect that information. So yeah, just emphasizing that technology and I understand there's a lot of privacy that concerns that can be around what 911 sees and what 988 can see. So I just look forward to when that works very seamlessly, as I think we all do.
So what we'll do is Brian Sunahara is our chief engineer. So what we'll do is we'll do some outreach to you direct to get those PSAPs, and then we'll, from the 911 988 program level, we'll see what's happening and see how we can work with all the vendors to make that a consistent configuration across the state, at least in the interim. I know it's been tested with the NGA system. The ability to transfer. I have a few confirmation questions that I want to drill down later today with NGA, but we'll get confirmation off the state's platform exactly what you should expect. And the really, it's going to come down to the user's experience, the caller, your dispatcher in the PSAP, and then your crisis counselor in the 988 center. We need to make sure that they're getting all of the appropriate information and action through the system.
Yeah.
May I bring up a process issue? And one of the things I was wondering about with this work group, and I really appreciate, Jeff, you heading this really complex issue. And I'm just wondering if there's a way that we can really engage the public in a very important conversation around 911 988 transfer. I know you want to also handle the technical side, and I think a lot of that can be done with the expertise here. But there's so many huge implications, and we see all the time in the news things that happen. For example, just recently, Sacramento County Sheriff made the announcement in the news around the sheriff, the county sheriff will no longer answer non-criminal mental health calls, and that should go to 988, as well as the county mobile crisis. So like a small matter of the state putting out a guidance for 911 to 988 transfer, um, it's not a small matter. And you worked hard on this document. There's still comments that I think what's on there is still not updated because I know Cal HHS, Sun DHC has not
Yeah, we have
comments
not.
back in May.
We have not, our working group has not had an opportunity to meet again to discuss the comments received, the feedback received and incorporate. I think at this point, again, based on this discussion, I like the idea of looking at my recommendation to the board would be looking at that NINA document, taking that feedback and comments and with the existing document, and then see how we can kind of make that cohesive enough. That one of the things that I am fearful of is making a document that's so onerous and difficult to decipher. What we're trying to do is simplify processes. We're not trying to especially when it's a recommendation. We have no authority to tell a PSAP what to do, how to do it. But I think if we help them understand the value, like you alluded to earlier, to your question or to your statement about what can the state do to educate or to maybe guide the public, my desire would be that the public know to call 988 directly, where we don't need to worry about transfers. That's where I think the goal needs to be, and that's why I made that comment earlier about I'm still astonished by how many people don't even know that 988 even exists. They've never even heard of the numbers. But I think that should be our goal ultimately, so the help seekers know where they can best seek the help. With that said, the reason we're going through this process is to make sure that for those who don't know that, still receive the help they deserve. And it should be fairly transparent to them without understanding. Like when you call 911, you shouldn't have to figure out of making a decision that I need an ambulance and a fire truck. That's what the 911 professional does. They figure out based on that call. And so that would be like my desire in that direction, to incorporate that feedback that has been received, to incorporate into the what would result in an updated document. But I think the still key piece is that those technical aspects of it. How do we implement that?
Yeah, I definitely appreciate the work that goes into it, but I'm just wondering if there's a way that the board can make this a supported state process that is a public-facing work group. It's not clear who's on the work group. It's not clear that we have adequate county or community behavioral health representation. Because again, we're looking at the widespread policy implication and how it's going to affect an entire crisis care continuum. So I think we've done an amazing job so far with the draft. It's time to make this a public-facing working group that is clear who's on it, right? That it becomes a state document. What are the statute? What are the requirements that we're trying to meet? What are the goals? Can we break it down into small steps, stepwise? Because if we issue, I will tell you, 988 centers have already been pressured by their local PSAPs, right? We know that. We know the needs out there. We want to help our PSAP partners sooner than later, but we want to do this in a thoughtful manner.
I think I would just share that the state's going to play a really important role in this, right? So I think for those representatives that are here on behalf of the state, I think reporting back to your leadership is really important. And certainly, this is an advisory body, and while it's very important, there are very distinct roles that, California Health and Human Services plays, right? And all of the departments under them, and also Cal OES. So I think that this is a great opportunity. I mean, as I'm hearing all of this, I'm taking it in to really think about which state agencies to go back to and have some conversations. So I think it's a great conversation, but this body is not alone in this, right? the full weight of state government. It's going to be a network with the locals, I mean, the entire ecosystem. But I think that there's a lot of tools in kind of the state family that we've not availed ourselves of yet that I think can help surge the focus. But, I think this is great problem identification, but I think that there's a lot of good conversations that can happen.
And I'm going to agree, Jeff, with everything that you said, especially coming from the 911 perspective. There needs to be a campaign out, sooner than later regarding 988, because although we could give recommendations, I think there's a misunderstanding that when someone calls 911, the policies and recommendations that those centers have to go through that might fall under Chief, that might fall under JPA. There's so many things that they just can't do. Especially with suicide callers, some of them you just can't transfer to another entity based on what that caller is saying. If they do transfer, they might have to hold on the phone, which ties up another dispatcher for 20, 30 minutes because they can't release. So I think the sooner the public knows that 988 is available, I think it relinquishes the policies that some of the 911 centers have to follow through, that were rules or policies that they can't avoid because of some of the stakeholders might not be a part of these either working groups or part of this board. So some of the chief associations, whether it's with the fire, EMS, or police, really need to be involved in this. If calls have to go to 911 first, they help make those decisions of what we do next. It just doesn't fall on the centers and the directors. There's other rules that govern that actually might be county, city as well. So I think a campaign needs to go out sooner than later to relinquish some of that. I think some of those calls might come to 988 sooner. I am worried about the capacity that these centers have once we relinquish that and say this is available. But I think we're misunderstanding, or we're not misunderstanding, but missing a very key point of what happens when these calls hit the centers first. One more thing to add too. I just thought about the Academy for Pro QA because some of these centers are accredited. I'm not for sure if it would affect their accreditation if they received a call, particularly for suicide, and did not go through the Pro QA or the recommendations of the Academy, if that would actually affect their accreditation as well. So there's other topics I think that we're missing on this.
Can I ask a point of clarification? So you would launch a campaign sooner rather than later to raise awareness about 988. And Doctor, you had shared previously that there was kind of the geolocation component that you thought that we would hold a campaign until that piece was completed, or did I misunderstand you?
So personally, I think sooner is better since it is live and is accessible. I was relaying what a number of county behavioral health directors have done. So most of them are on board with the idea of a campaign, but they say once that is live. But it sounds like, based on this new information, that a number of the carriers are going live sooner. Because my understanding is that FCC hasn't issued their final rule about carriers have to do this by X date, but it's going that way.
Thank you.
Just to follow that line of thinking, Dr. Bowie had mentioned earlier, kind of to reflect your concerns about the current 988 center's capacity to receive all of these calls. Dr. Bowie mentioned back of the napkin math of 1%. Instead of going to 911, going to 988, what would those impacts look like? And similar to how Vibrant did a geo-routing impact analysis to say, California 988 centers, based on geo-routing, this is how we anticipate your volumes to change. Maybe there needs to be a similar analysis of, for 911, like if 988 were to be more publicly promoted and people would go there first instead of 911, like what's that call volume look like? And 911 center, like PSAPs might know now that this percentage of calls we would want to potentially transfer, and seeing those volumes, how those translate to what the receiving centers in their region would handle. Because I think that's the big question that we don't know yet is what is the impact of everyone being aware of 988? And I think looking at, well, what are the calls that PSAPs would most likely transfer if they are able? What's that volume look like? And how would it impact their local center?
So we have a statewide 911 data analytics platform. And I believe we could work with them if we can get some basic shape files of where the 988 center's coverage is. I believe there's a way that we can start to extrapolate that number and give at least the back of the napkin, if not a little bit more formal on what the 911 transfer impacts could look like. So let me work with that team to see if we can start to shape something up there. And then Dr. Bowie, I know we had previously discussed, and I've got a note here, when we work with Jeff's team, what we'll do is we'll start to formalize that document. And I think what we could also do is work with the working groups. We can get the working group information, the names and who they're representing, and start to put that on our 988 website, and then make sure that we have the appropriate folks represented in these working groups. And if we need to, then we can start to do some outreach to add whoever's missing to the working groups.
I support that. However, as I know is the case, and Dr. Bowie does an amazing job with the policy advisory group, because I'm a member of that as well. From a workability perspective, also concerned by what the number of those individuals look like for a working group. So to make it effective, to be able to accomplish, especially when we're really defining a document that can be presented to this board, that would be my concern, is making sure that it's not just anybody and everybody who wants to participate, because if we have an overwhelming response, then it just can become a little more challenging for producing a workable product in the time frame that this board desires, which ideally would be by the next meeting. So we can talk offline on the logistics of that, what that will look like, especially incorporating the technical piece with Kurt and Ryan and other members of your team.
Absolutely. Thank you.
Thank
And
you
it-
very much for that. May I add a clarifying point on the communication about 988? So although there isn't a statewide campaign on 988, our local 988 centers have been involved in advertising 988 in the communities for a long time, as well as there's been a national campaign since the summer of 2024, which is still going on now, including things that I'm constantly learning about, like kiosks about 988 at 15 California campuses, targeting students who are from AAPI, Native Hawaiian, and Spanish-speaking communities. Like, okay, well, that's fantastic. That's some of our populations of focus. So there's constantly things that we're like learning from what's happening at the national level, local level. So when I said that there isn't a statewide campaign, that's the kind of level of coordination that I'm trying to talk about, in terms of, again, if we're going to launch a campaign, we want to be able to do a pre and post, and understanding the effect of the communications, as well as estimated impact, as you said, on volume, and how we're going to handle those kinds of things. So just that kind of thing. But I think there's always a poll back in 2023. It's probably somewhere in the plan. Probably under 50% of Californians know about 988. So we're kind of a little bit more aware. 988 has been on some student IDs, not statewide, but on many. So, I think the word is out there pretty good for 2 years. We could do a better job, and we could do a more thoughtful job. That's for sure.
I just want to add that a lot of the 988 Center has been very anxious, and just to concur with Jeff, earlier statement that we would like to have the guidance and recommendations from either the board or the working group about 98, 911, collaboration or interactions, the sooner the better, because that's what the local 98 Vincent Center has been waiting for a while. So, to the extent that we can to expedite this process, the sooner the better. And I don't believe that the 98 centers, the local 98 centers waiting for something that is going to be like perfect, but a lot of the conversations going to be involved at the local 98 911 center levels. But having a set of recommendation and guidance from the state or from the state, work group will be something that is um, beneficial. But I believe that ultimately that a lot of the detailed conversation will involve at a local level with 98 911 jurisdictions.
Okay. So we've got some work ahead of us, Jeff.
I like how you throw my name in there. Yes, we
Yes.
do. Yeah, I mean, that'll be our push and our focus to be able to, so just so that I'm clear, we work through some of those technical questions that play a role in how the procedurals will go, refining the procedures with the input that has been received, and then also looking at the NINA standards document to see if we have any gaps or see how we might be able to align the previously produced document from my working group to those standards. And then with the objective of presenting that to the next board meeting. Is that what you intend, Paul?
Yes.
Okay.
Yeah, we'll get some framework.
Okay.
And I think that'll be a good touch point so we can make sure that the direction your group has is consistent with what the board is asking.
Okay.
And I think once we get that framework established, I think you've done a lot of good initial work, and what the NINA document gives us, I think it'll start to frame up pretty quick.
And another point of clarification, because the document does focus a lot on the criteria for what calls are transferred, and that goes from 988 to 911 and back and forth. To Dr. Bowie's suggestion, should we be focusing on revising that to narrow it down to suicidal for now, or do we want that broad approach that we have been taking? So that's the other clarification I think I'll need to bring back to the working group.
And I think we can work through that offline in the next working group meeting. We'll make sure Dr. Bowie's invited in a part of that conversation.
Sounds good.
All right.
Thank you.
Thank you. Any other questions or comments related to the transfer guidance conversation? Any comments from the public related to transfer guidance? Right, thank you. Next is agenda items for future meetings. Does the board want to present any agenda topics to be added to the May meeting? Okay, the next meeting is May 15th. It'll be here in this meeting room at 6:30 Sequoia Pacific in Sacramento. And then we've got our August and November meetings calendared. About August, we'll start to work, the team will start to work to project through the 2026 calendar year and get those meetings put on calendars, and we'll start to advertise those future dates as well. Open up for public comment. Is there anyone wanting to make public comment related to 988? All right, thank you. Hearing no request for public comment, then we move to adjourn. It is 12:05. Thank you very much for attending today.